This week on Healthy Living, we are highlighting the role of medical imaging in the prevention and treatment of health conditions. In South Africa, 2 women are making tremendous strides in the field of nuclear medicine. And a U.S. charity trains medics to improve healthcare in rural Kenya. Plus, a new cholera vaccine brings hope for an increase in production and global supply. We'll have these stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Welcome to Healthy Living. Medical imaging plays a crucial role in tackling diseases. Radiology, ultrasound, and computed tomography, or CT scans, are some of various technologies that medical experts rely on to gain insight into the body to diagnose, monitor, or treat medical conditions. The World Health Organization says almost 2/3 of the world's population, primarily in low and middle income countries, lack access to basic imaging technology, partly due to a shortage of trained personnel. Nuclear medicine is a medical specialty that utilizes small amounts of radioactive substances to diagnose and treat various diseases. 2 South African doctors are demonstrating that the sky is the limit for women. Both are nuclear physicians at the Steve Biko Academic Hospital in Pretoria. Tuso Kumalo visited them and filed this report.
It's early morning and Dr. Khumuso Mukwala is already working in the day ward in the nuclear medicine section of the Steve Biko Academic Hospital, preparing to examine and treat a non-melanoma skin cancer patient. She is one of only 100 nuclear medicine physicians servicing South Africa's over 60 million population.
Nuclear medicine is an ever-evolving field, so you constantly have to be updating yourself with the latest developments that are happening, so you have to read a lot.
It's a fairly new discipline of study, and she has successfully emerged with a Bachelor of Medicine and Surgery degree, fellowship at the College of Nuclear Physicians, Master of Nuclear Medicine, and a doctorate in nuclear medicine philosophy.
We're actually one of the first few centers in the world that was doing actinium-225 prostate cancer therapy, thanks to our mentor and our head of department, Professor Teche.
Dr. Mukwala's daily work involves supervising other physicians who are also making their mark in the nuclear medicine field.
In this room, patients who are referred by various doctors with many conditions are scanned, and the technologists are generally the ones responsible for scanning in this room, and will place the patient on the bed and stand behind that door glass and let the patient lie down and be imaged.
Once the technologists have completed scanning the patients, the pictures are then transmitted to this gamma camera room where Dr. Mukwala and other nuclear medical physicians analyze them. It's crucial for them to look very closely at the images to ensure that all abnormalities are reported.
Right now what we are doing is PET-CT, and PET-CT is usually requested by doctors of patients who have cancer, and so we report those, and it helps the doctors know whether the patient needs systemic treatment or local treatment.
She is also thrilled to be paving her path in these uncharted waters.
Very proud to be a nuclear medicine physician. I enjoy it. I enjoy what I do.
Dr. Mukwala also enjoys her work.
Even if I try to sit and think what other options could I have taken in terms of career choices, this is always my number one for me.
Dr. Mukwala also has words of encouragement to other women.
It's not impossible. The sky is the limit, and we shouldn't allow the glass ceilings that are placed there for us as females to dictate who we become.
As the current president of the South African Society of Nuclear Medicine, Dr. Mukwala and her team have been invited by the International Scientific and Medical Organization, the Society of Nuclear Medicine and Molecular Imaging, to attend its June meeting in Toronto, Canada, to recognize the great strides they are making in nuclear medicine. Tuso Kumalo for VOA News, Johannesburg.
How challenging is access of medical imaging services in your community? Have you ever been concerned about the safety of X-rays and other medical imaging? Here are some reactions from Nigeria.
For many of us that grow in the trenches, it's actually a bit challenging to access those medical imaging. It takes actually many kilometers to actually be referred to those areas that have access to it, and also looking also around what even the medical areas. So the basic X-ray is a bit accessible, while others, especially people that have cancer, which is prevalent in our areas, and also places that need advanced care, is actually very challenging.
I think it's very, very difficult sometimes because so many people are scared of going for that. It's lack of orientation about that. It's one of the reasons that makes people scared of going for X-ray.
So the major challenge is finance and then the availability of the equipment. So it's always a drawback for some people when even the doctors recommend you have to go do an X-ray to find out what actually is wrong. They hold back because they can't afford it.
In accessing medical imaging in urban community is more accessible because there are two things one has to look into. There are two challenges. I can say in medical imaging we have what we call accessibility and what we call care of standardization. So, and also there are big differences big swing between what is in rural community and also what is an urban community. So in an urban community, it's easy for one to access medical imaging, more of like in rural community.
I'm not saying the medical field, so everybody will always ask because there has been to be an established or pre-existing fear because of lack of knowledge in that area or lack of proper awareness.
Dr. Stephen Ojwang is the CEO of Premier Care Hospital Group in Nairobi, Kenya. He discusses the importance of medical imaging and some of the challenges of access in Africa and possible solutions.
There are many ways of, many forms of medical imaging. There are those which use technology called ionizing radiation, which include X-ray or gamma rays, like we see in what they refer to as nuclear medicine scans. And then we also have other modalities that use non-ionizing radiation, and that includes other imaging modalities like MRI or ultrasound, which uses high frequency sound waves. We also have other imaging modalities. Depending on what the patient's condition is at the time, then usually we make a decision on which is the best modality. For example, a patient who is coughing and has chest conditions, because of that, the X-ray has been found to be very useful over many years. In case that condition persists and we probably need a bit more advanced investigation, then we would scale that up to a CT scan, for example, because an ultrasound cannot very well give very good images through air. But the CT scan will be better in case you have a patient who has an emergency, maybe has a stroke or has had an accident and is bleeding in the brain. The impact of healthcare that is availed by diagnostic imaging is very critical because for any medical professional to be able to make an accurate diagnosis of disease, the diagnosis is the most important, because once you've been able to identify what is ailing the patient, what is the primary problem of the patient, then you can then give them the right treatment. For sure, there is hesitation among some people in terms of use of medical imaging, and it is for us as the healthcare professionals to make sure we protect our patients. For example, for pregnant women, we should not expose them to unnecessary radiation, especially in the first trimester. However, it doesn't mean that a pregnant mother cannot have an X-ray, let's say if she has fluid in the chest. The other area where people are hesitant is in terms of doing an MRI. I once did an MRI in our workplace, and the feeling in there sometimes it's like someone might even think they are in a sort of a grave. So it can be very scary for people who are claustrophobic. So we encourage them, and usually either we cancel them or we take them to a special MRI called an open MRI, that is not necessarily enclosed. So yes, there are definitely areas of hesitancy, but the good thing is that an accurate diagnosis can save your life. An accurate diagnosis will allow you to live tomorrow, to be there for your children and for your family. So it's very important that as healthcare providers, we explain these facts to the clients that visit us.
Experts say one of the healthcare challenges in Africa is a shortage of training and education for workers. To help, a U.S. charity called Mission to Heal is training local workers who will serve patients in remote locations. Juma Majanga reports from Ngurunet village in northern Kenya.
It's a beehive of activity at Ngurunet Health Center in a remote village in the dry Marsabit County in northern Kenya. Residents have gathered here, some traveling tens of kilometers to seek medical services. On this day, the U.S. medical charity Mission to Heal is providing more advanced medical equipment and training local medical workers to use it.
We take the experts that live here and we bring them in there and show them how it is that we can do things and get the principles without the plumbing. Taking care of the people in the context of their culture and their family setting is something that's going to happen here.
Meshak Lekeda is a local nurse at the Ngurunet Health Center.
They've even taught me how to manage some new conditions here and there that I never knew before. And they've even equipped me with the equipment.
A 2019 report by the U.S. National Institute of Health found that a key problem facing the healthcare in Africa is weak training and education of workers. Kristen Alcon, a volunteer, says Mission to Heal can help.
They have the knowledge, but their resources are limited. And so I think that we can help them try to best manage things and come up with diagnoses and come up with the best possible diagnosis and treatment with their limited resources.
Senaheya Kalaili traveled over 30 kilometers to seek treatment.
I came here in a lot of pain, especially my abdomen. The doctors gave me 2 injections and medicine, and now I feel better. The pain has gone down.
Volunteer medical students say they are learning too.
Obviously the culture is very different and the resources are very different, so there's been a steep learning curve in terms of figuring out what we can do and really what we should do.
The UN Development Programme says some 408 million people in sub-Saharan Africa still don't have healthcare. Mission to Heal says it has trained 3,200 healthcare workers on the continent. Juma Majanga, VOA News, Ngurunet Village, Kenya.
The World Health Organization has approved a new, simpler version of an existing oral cholera vaccine. The Uvicol S vaccine is a simplified formulation of Uvicol Plus with fewer components and has a similar efficacy rate to existing vaccines. South Korean firm U-Biologics produces the drug, and the WHO says the simplified formula should allow larger volumes to be produced faster. Meanwhile, 3 more African countries have joined the rollout of malaria vaccines, targeting millions of children in Africa, which accounts for 95% of malaria deaths, according to the United Nations. Benin, Liberia, and Sierra Leone are offering the malaria vaccine as part of their childhood immunization programs. 2 vaccines, RTSS and R21, recommended by WHO, have been seen as a breakthrough for child health and malaria control. That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Lenore Moudou. Until next time, stay well and strive to make every day a healthy day.